COVID-19. Professor Gray, welcome. So SABC calling for the closure of schools. What do you have to say?
Well, I'm also a pediatrician, and as a pediatrician in South Africa, we have been watching the epidemic, and we've been watching the epidemic both globally and locally, and have had a keen interest to see how COVID-19 affects children. And what we can say that of the 13 million infections, very few have happened in children, and of those, there have been very few deaths. So deaths in children is a rare event. It's a rare event, and in China, in the first part of the epidemic, no children under 9 died, and only one child in the ages of 10 to 19 died. We've been looking at the death rates in the UK and in the US, and in all these areas, the death rates amongst children always and severe illness always is less than 1%. So globally and even in South Africa, children are usually asymptomatic. They don't transmit the viruses as adults do, and they have biologically they're less susceptible. They have less ACE2 receptors. Their immune response is different, so they don't have these hyperimmune responses, and also prior exposure to other viruses gives them cross protection. So even in South Africa, we've been watching the demographics of mortality, and we've seen that very little children, even in South Africa, of all the deaths that have happened, less than 1% have happened in children. Every death in a child is tragic. And so I can understand why parents and teachers are concerned. But in this epidemic, we do know wherever you are at a global level, children are less likely to get sick from coronavirus and are less likely to transmit it as compared to adults. So I think it's more about the teachers. It's maybe the teachers are concerned about them being exposed to children that have coronavirus, and they're more likely to be exposed by adults rather than children.
Professor, however, I know parents who listened to this in the beginning, and then there was a report recently saying 7 children died in just 1 week in Gauteng, which sounds alarming, and they were all under the age of 9.
So we've looked at that data, and we're trying to accumulate the data carefully, but it looks like a lot of those children did not die from COVID per se, had other conditions like congenital heart disease, and some of them may have died with COVID but not from COVID. So I think that we have to investigate those cases very carefully before we make a call that these children died directly due to COVID-19. So we're not exactly sure. So I think that we have to understand that parents are alarmed, and they are concerned. We're living in exceptional circumstances, but we do know from a global level, and even from South Africa, that children, fortunately, have largely been spared from the ravages of this epidemic. What we do have to worry about, however, is making sure that our children implement non-pharmaceutical interventions, and that teachers with comorbidities are protected from transmission or acquisition.
Well, Professor, isn't this the main thing, that it's a holistic approach, because it's not only the children, even if they are somewhat resistant, involved, it's the teachers as well, it's the people that the children interact with, the elderly, the communities, their families. So overall, are you saying you still wouldn't support the closure of schools? And let me just throw in there, Professor, let me just throw in there, because we won't have much time afterwards, the WHO also saying maybe it's not time to open schools when community transmission is still high, and right now in South Africa it's rife.
So we need data, and it has to be a data-driven decision. We know that 1.4 million French children went back to school, and only 70 children got COVID infection. And we also know that children are less likely to have less viral load, or less likely to transmit infections to adults. But having said that, we do have to make sure that teachers who are old, who have comorbidities and have increased risk of susceptibility are protected, and they are engaged in other non-teaching activities. Likewise, in families where there are intergenerational households, we have to make sure that we protect are elderly and vulnerable from COVID-19. We do know that adults are more likely to transmit to other adults, and it may not be the child that's driving the transmission, but being in contact with other adults. And so we need to make sure that we understand the data. I also would like to have more interactions with WHO to try and understand how they came to that position. So we do have to engage with WHO and make sure that we understand what their rationale was, given the global data on children.
It's also a question of disruption. So I've got some data here relating to just Gauteng. As at the 9th of July, there had been more than 1,000 total cases and 105 schools closed because of infections. Of course, then the schools have to close and reopen again. Looking at all of this, so you are a member of the Ministerial Advisory Committee. Would you still advise open schools?
Well, I think you have to look at the risk-benefit ratio. We have children who are starving because they don't get food, and the school will provide them food. We also know that children at a global level and a local level are not going to be affected as much as all elderly people. So we have to look at our data, and we have to make the best decisions for South Africa. We need to make sure that our children get an education. Not starting schools will have huge ramifications for years to come, a knock-on effect. And so we have to try and protect our children, and protecting our children is also protecting them and ensuring their education. And so we do. The Pediatric Society of South Africa and pediatricians support the data that we've seen, and we recommend that we continue to open up schools so that children can go to school and have access to education.
Dr. Gray, while I have you, I have to ask, I think this was one of the things that you criticized initially, saying it was unscientific to close schools in the first place. And then, of course, we know there was a storm of controversy, and the health minister said that you had actually apologized for some of your comments. There was criticism, a lot of back and forth. Can you just tell me what you stand by now, based on your first critique, what you may have apologized for, and how the relationship is between you and the health minister right now?
So I think we all believe in data and to make data-driven decisions. And so where we have data, we will present the data to the minister and to the Department of Basic Education. And so we believe that all our decisions in South Africa should be data-driven. And we will have differences in interpretation of data, but the data should stand and should be the thing that we stand by. And sometimes we may disagree, but as long as we have data to stand by our view, I think that's important. So I think that it's important that we understand the anxiety of the teachers, and we need to engage. It's all about communication. We need to engage with the parents. We need to engage with the children, and we need to show them what the benefits and side effects are of opening or closing or keeping schools closed. We have to understand that there are benefits of having schools that are open. There's mental health issues, there's hunger, and there's the importance of the depression that we're seeing in children who are deprived and are contained in households without stimulation.
Sure, and just finally that question, how's your relationship with government?
Our relationship is very good with the government. So I think that we are scientists and we're allowed to have disagreements, and we're allowed to disagree, and as long as we can find a way of communicating, and that's important.
All right. Thank you for giving us your view tonight. South African Medical Research Council President Professor Glenda Gray joining us via Skype. And of course, she is a member of the Ministerial Advisory Committee on COVID-19.